This is just a quick nursing overview of our new Servo U ventilators. I'm just going to go over some of the key elements that you'd want to know as a bedside nurse, just in case you have to interact with the ventilator. You'll notice at the top left of the screen here is your alarm silence button. So you would just tap that and it's going to silence your alarm for 2 minutes while you're addressing any type of troubleshooting issues. If for some reason you have a sustained alarm that you can't troubleshoot, please call your RT so that way they can come and assist. There are 3 different types of alarms that you may see: a low priority, a medium priority, and a high priority. We are most concerned with the high priority alarm. The way that you'll know it's a high priority is there'll be a light that illuminates up here and it will illuminate red. And I'll show you that now. This top bar turns red and you'll see all the red on the setting that is actually alarming. So in this instance, it's saying that there's a low minute ventilation alarm that is blinking. And so if you have to call your RT and let them know what's going on, you can always let them know which one of these is illuminated red. At the very bottom of the screen here on the left, you'll see it says 100% boost. If you tap that button, it's going to automatically increase the FiO2 to 100% and it'll last for 1 minute and then it will return to the previous FiO2 that was set. At the very bottom of the screen, you're going to see what the patient is actually on. So this patient is set to 40% FiO2, a PEEP of 8, a respiratory rate of 15, and a tidal volume of 400. To know which mode you're on, you're going to look here at the top left. And so this patient is on volume control. The tiles over here is what the patient is actually doing breath to breath. So if you need to know what the patient is doing right now, you could see that they're breathing at a rate of 15. Their peak pressures are 26. This is their mean pressure. This is their exhale tidal volume. So that can give you a good idea of what your patient is doing breath by breath. If for some reason you needed to make a sustained FiO2 increase, not just using your boost that only lasts 1 minute, you could actually go into the O2 concentration, which is your FiO2. You're just going to tap that, use your plus or minus to adjust your FiO2. So I'll increase that to 50. I'll hit my check mark to save those settings, and then your FiO2 is increased. That will make a permanent change to your FiO2 setting. If you notice an acute deterioration in your patient with no chest rise, don't forget that in an emergency, it is okay to disconnect the patient from the ventilator tubing and bag your patient until an RT or the team can get to bedside and troubleshoot what is going on with the airway.